Hey, welcome back to the Defeating Pain podcast. And I have not just a special guest star, I've got a very special guest star. And we always say it's a small world. Let's talk about that small world. We have Dr. Melissa MacDonald on, and I practice and have lived in northern Michigan since 2001, Gaylord, Michigan. And when I was researching movement and was online back at where I went to chiropractic school, Northwestern. Well, back then it was Northwestern College of Chiropractic. Now it's Northwestern Health Sciences University. And I saw Dr. McDonald, came across you some way over on the website and then through LinkedIn. So we really,
Mhm.
connected through LinkedIn. And from there, I found out that Dr. McDonald grew up, went to high school, a very short distance, and then to
Mhm.
even put a stronger punctuation mark on this whole thing, her parents bought the building that I used to practice in, and we used to have a very large rehab center downstairs, and there's still turf. I had to leave the turf when I left. Dr. McDonald?
Um, Absolutely, yeah, my brother-in-law, Austin, absolutely loves the short game work he's been putting into golf downstairs in the turf area. It was such a crazy thing when my parents acquired that building and then were like, "Hey, look at this turf," and I was like, "Well, who was here before?" And that is when I learned that had been your prior rehab space, and I was like, "Ah, maybe I should just move back to Gaylord and open my practice in your basement." But I am too sunk into the sports world out here in Minnesota
Yeah.
to ever consider really leaving at this point.
No, and one of the reasons for that is for 22 years, I was the team chiropractor for our local high school. We didn't have an athletic trainer, even though I kept asking them to bring one on, they just didn't do it. Maybe because I spoiled them. I don't know. But at any rate, when that building came open, the basement was just empty, and we decided, okay, let's put some turf down. We did some resistance band stations. We put in the big horse mats. I went and got them at Tractor Supply. At that time, they were pretty inexpensive, and that was our mats. And so we did a lot of different things. And then oh boy, July of 2022, I came in one Saturday morning, and I never would come in on Saturdays. I was actually meeting another doctor, and I was gonna show him the clinic and everything, and I came in, and we're flooded. My side of the was all flooded. The flooding was so extensive and so bad, and all the contractors in the area were so bit we had no idea when we were gonna be able to get back in, so we made the painful decision to move everything out and then move into the just up the road to where we've been and where we currently are now. But it was heartbreaking to leave that rehab area because we had kids coming in every Saturday. The football team came in and did the recovery sessions. We have Normatech, and they'd come in, do stretching and their Normatech sessions. The girls soccer team would come down and do film sessions. We did off-season workouts, speed and agility training, strength training, the whole works. So yeah, it was very, very painful to leave that, but at the same point, at the school then got a strength and conditioning coach, and so it
So
all
wait,
worked out.
they got a strength and conditioning coach before they got an athletic trainer?
Yeah.
That's okay.
So I was covering everything. I did football, so I was at all the practices. So I'd get done at the clinic at 5 and go to football practice. I did boys soccer in the fall. I did boys and girls basketball. In my last year, they talked me into doing hockey, and then I did girls soccer in the spring. And again, after 22 years, it was like it was time. I just
Yeah.
couldn't do it anymore. I was getting home at 9 or 10 o'clock at night most nights, but yeah, I don't wanna say I begged the administration to get a athletic trainer, but they really that's what they and they still don't. They've got 2 other chiropractors that a husband and wife team that are doing it, but Man, they really need athletic trainers.
So as someone who works, I actually manage 3 high schools out here, and I then independently contract providers to help support that because, of course, I can't be in 3 different locations or sometimes some nights 8 different locations at any given time depending upon the season. So, I contract independent providers and I contract with athletic trainers to cover those things, and
Mhm.
as a dual license, so I'm a chiropractor, but I'm also an EMT, it allows me to feel fairly comfortable and confident in those spaces.
Sure.
But when I have the ability to co-manage a sideline with an athletic trainer, hands down, I'm doing that because it's just a better outcome for the athletes. It's one of those things that having graduated from Johannesburg-Lewiston and looking back our sports medicine coverage or lack thereof,
Mhm.
I recognize that what I probably would have gotten my athletic training degree if I had known it existed. But because the schools didn't have it, it wasn't something I was even aware of and what it looked like as a career. And it just boggles my brain that they're still in 2026 not having that level of expertise on their sidelines, those poor athletes.
What we found is that over the last couple of years I was doing this, there was a lot of Class A schools that did not have athletic trainers because of budgetary concerns. Because what happened is that, they raised it to you had to have a master's degree,
Mhm.
and then that increased the demand for salary, and the high schools just didn't keep up with that demand. I was very fortunate. I had a medical doctor, a good friend of mine, Dr. Derek Olson, who had a fellowship in sports medicine. So he was with me every Friday night for varsity games. And we had a and for a number of years, since 2004, I think it was, he was with me. And so basically, I took care of the spinal and he took care of the extremities. I would go out to the field, bring the kids back, and then he would be doing the assessment and I'd be back, looking to see what was going on. But it's the thing I respect about the athletic trainers, they are very well trained. And I even tried to get our community, Gaylord Community Schools. I said, listen, I will hire one to work in the clinic like they do in the hospitals, because I think the athletic trainers are perfectly suited to be like our physician extenders in chiropractic.
They really are. I'm surprised. So here in Minnesota, we have a slightly, and I know this is a little off topic probably from where we're going to get to in the bulk of this episode, but in Minnesota, majority of the athletic trainers are actually hired and managed by the hospital conglomerates. So out
Mhm.
here, it's Alina and North Memorial, HCMC, TCO, those large medical groups. And then the schools contract with the hospitals to then have their athletic trainers provided for them, which ultimately for independent athletic trainers has undercut their abilities to work in schools because the hospitals can give such a significant discount because they see having their staff and employee at that school, it
Mhm.
automatically is going to create a direct referral portal
Yes.
for all the orthopedic injuries and surgeries and rehab that can occur during any given sporting event. So I am surprised that Michigan hasn't adopted a similar situation, especially now that the athletic training degree is a master's that allows schools to have this discounted high level care and yet allows the athletic trainers to be appropriately paid.
In the larger cities, that is the case. Um, the feedback that I received from Otsego Memorial Hospital is that and from an orthopedic surgeon that had relocated that used to be with the Saints. He thought it was ridiculous we didn't have an athletic trainer, but it was budget concerns. There wasn't enough sports medicine to come in. It was back to money. So they didn't feel like their physical therapy could handle the salary of an athletic trainer because there just wasn't enough sports medicine injuries coming in. And or that could have been because they knew at the time I was seeing all the sports medicine injuries. So um there's definitely a need out there, but this is gonna segue perfectly. So, give everybody your background, because
Yeah.
Joburg and Lewiston's about 25 miles away from Gaylord. So, when did you
Yeah.
graduate from Joburg?
So I graduated in 2006.
Okay,
And when I graduated from there, I then went up to Lake State and got my bachelor's in chemistry, actually, and then went to Northwestern Health Sciences University in Bloomington, Minnesota, and graduated with my chiropractic degree in 2015.
okay.
Now, during my time as a student here at Northwestern, they developed the Human Performance Center, which is basically their sports and rehab clinical space, but really focused not just on athletes, because human performance, majority of our people aren't athletes in the normal real world. But I'm sorry if you have ever talked to parents of 2-year-old toddlers and they're having to wrestle them into a car seat. That is an athletic event if I have
Absolutely.
ever seen one. So our athletes just look a little different. So I had an opportunity to be a sports resident within the Human Performance Center for
Wow.
2 additional years of postdoctoral training. And just, I like to think about it as drinking from a fire hose with the level of events and speaking and teaching and just kind of being thrust into opportunities that I wouldn't have had as just a clinical provider out in my own clinical space. After completing my residency in 2018, I stayed in the Minnesota area and started my own practice, which I still have, and started working at the school as an adjunct instructor within the emergency care curriculum. And then had an opportunity and came full time to the Human Performance Center coordinator. So our current sports resident help direct our clinical care across both our clinical time and our sideline time and our event times.
See, and the thing is, I think you'll agree, and one of the reasons that I agreed to do this here at Gaylord is that I practiced in Arizona, and Arizona's scope was so broad, and then when I moved to Michigan, the scope was so narrow, and I didn't wanna lose my skill set, and so you really gain valuable skill sets by being on the sideline and seeing these sports injuries. You learn about mechanisms of injury, you get really good at your orthopedic testing and diagnostic skills, and then it carries over because everybody's an athlete in one way or another.
I definitely agree with that. Like, I use my powers for a little bit of evil. And what I mean by that is I'm in a fantasy football league
Okay. Alright.
and I will make draft and trade decisions based off injury reports and prior history of play. I'm about to get kicked out of the league because I've won 3 years in a row, but that's a side point.
Well, hey, insider trading. That's great. That is so funny.
So, but it just solidifies your skills. It also solidifies your quick decision making. You have to be able to process things in a rapid fire stance of one, does my athlete need 911 right now?
Yep.
Can I get them to the sideline and assess them? Is this a life threatening? Is this a non life threatening? Okay, my athlete is screaming bloody murder. Is this a true, oh my God, I'm dying scream? Or is this an emotional, I'm upset? Because like this year was two really good examples. I had a football kid broke his arm. He was just annoyed. Like I could see the extra elbow from the sideline of
Mhm.
that's a me problem. Let me go take care of it. And then during the basketball season, I had a kid roll his ankle kind of, or it's either he rolled his ankle or he kind of got kicked in the lower like part of his like there was nothing wrong. It didn't even swell. And he screamed for 30 minutes.
Oh, yeah.
And
Yeah,
I was
and
just like, okay, you're fine, cause like, anytime I'd be like, "Okay, I'm gonna call 911," he'd be like, "No, I'm fine." I'm like, "Okay, are you really?" And then he'd start screaming again, and I'm just like, "Okay, well, this is what we're doing." So it really challenges is your stress under function space,
Mhm.
and then when I can bring those skills back to my clinic, it helps me, 1, have people be able to describe what they're doing. I understand it because I can picture, because 'cause I've probably seen it on a sideline at this point after
Yeah.
having done it for 10 years across so many different sports. And then on top of it, it allows me to also speak in their language. When you can get onto an athlete's level of I was talking with a kid who's like, "Oh, yeah, I do taekwondo." And I'm like, "Oh, combat or ponce?" And he's like,
Mhm.
"I do ponce." And I'm like, "Okay, so let's talk about your different movements. Let's talk." And all of a sudden, I have stepped into a space where he's like, I can talk to this person and they get what I'm doing.
And that's huge. I just gotta share my favorite story about being out on the field. So we had our star running back, big, and this would have been about 2002, 2003. Before the season, his mother came to me and she said, "If you are out on the field, I'm giving you 5 minutes, Ted, and if you're out on the field with Tommy for longer than 5 minutes, I'm coming out." It was early, it was one of those hot August, nights that we can get here sometimes in Michigan. Cramps were happening, like, left and right. So I go out, Tommy's down, and he's just cramping well, first of all, when I first got out there, you would have thought he broke something, and then he's sitting there and he's just cramping, and what was funny was, you know how the refs are usually right around okay. So I'm sitting there stretching him out, and he's still just just going nuts, and I look over, and I see his mom darting across the gate, and I and the opposing players they're all kneeling, but they can hear me and see me, and I went, "Damn it, Tommy, your mom's coming out now. Get up. We're getting out."
Oh my gosh.
And I'm telling you, this wasn't this guy was well known through the Big North Conference. He was
Mhm.
our stud. The ref started laughing, the opposing team started laughing. You know what I didn't I never asked him after the game if there was any trash talk going on after
Oh,
that,
there
but
100% was.
oh, you know there
There
was.
100% was.
So this oh man, we could there's so many avenues I wanna take this, but I do wanna talk about sports physicals. And what's happening now in Michigan is that there's no scope restrictions or it's all our high school athletic association. It's the MHSAA that they want to know from athletic directors if it's a need to have chiropractors do sports physicals. And then, I mean, right now, if a concussion occurs, we cannot clear them. They've got to go to their MD, PA, family nurse practitioner, everybody who probably has not had any kind of concussion training as much as anybody that's along the sideline. But that's probably a whole other topic for another time. If enough athletic directors say that there is a need, then they're going to release that, allow us to do those. My issue from day one of being around the athletes is that the sports physical was a 15-minute, $15 just really just sign. I'm surprised there hasn't been more serious injuries or whatever, but I firmly believe movement has got to be a part of that. You've got to analyze movement, and I also firmly believe that non-contact ACL injuries, especially in female athletes, could probably be largely avoided with proper movement analysis and screening, and then seeing what the strength is in the quads and hamstrings and glutes. Am I just full of
You
it, or is movement I feel like it's very important as a baseline in many things that we do.
Oh my gosh, the rabbit hole you just are about to drag me into, like so, first of all, my entire residency was focused on female athlete and specifically knee injuries. So, that is a topic I could probably spend the next 3 hours just info dumping on, so I'm gonna try to rein that in, and then we also teach the sports physical course here at Northwestern because in Minnesota, chiropractors not only can do the sports physicals, we can 100% manage the concussions.
Okay.
And so all the things that you're discussing implementing in Michigan, we already have that in our scope here and do it regularly for our athletes and managing it. When it comes to our sports physicals, I am less concerned with the licensure and the credential of the person performing the physical. I
Mhm.
want someone who has had sports medicine experience of being on a sideline. Because you look at an athlete during a physical differently when you know you're going to be the person covering that person.
Mhm.
And if they have an adverse event, you're going to have to be dealing with it. And it just becomes less of a checkbox and more of a, do I know how to keep this person safe and secure? Because the thing is we've seen this years and years just chronically that maybe a kid makes it through high school, maybe a kid makes it through maybe a lower level college, but as they get into higher level sports and they're forced to do greater clearances, this is why some of the greatest draft prospects never make it onto the football field is they can't clear the NFL physical, but yet they've been playing for years and they're going, why can't I play? And it's like, you're too high of risk. You are showing all the classic, maybe electrical differences in heart, because we've finally got our physicals locked down that hypertrophic which is a thickening of the heart wall, is no longer the
Mhm.
most cardiac events within the United States. It is electrical differences, which have very vague symptoms, which is why the history of the physical is one of the most important components that I often think isn't taken as seriously when providers haven't been on the sideline and actually had to deal with a
Mhm.
cardiac arrest. And so I do think that there is a level of chiropractors can do these things. They just need to make sure that they have the appropriate training and certification. So Minnesota keeps everything really vague, both good and bad, which is where they're like, if you can show appropriate training, you can do this. So then the Minnesota Chiropractic Association and specifically their sub conglomerate, the Sports Council, has come out and kind of given a little better definition of what is a trained person. And so Minnesota strongly encourages if you're going to be doing sports physicals, you're at least a CCSP, so a certified chiropractic sports physician, or have your diplomate in sports medicine, or have a diplomate in internal medicine just to make sure that you can deal with and understand the ramifications of that cardiac exam.
Gotcha.
Now, from the head injury standpoint, they've also defined that as needing to have a certification of at least 2 years. Every 2 years, you need to show concussion training to manage
Mhm.
concussion. When it comes to the actual management and figuring out of what's going on with injuries, there are assessment tools, FSMA, SMA, FSMA, that when actually challenged in the literature for finding a movement pattern that then relates to injury, hasn't been well supported.
G
And so the things that we're finding, and when we're looking at male athletes versus female athletes, the everything kinda gets sucked into the female athlete it related to the menstrual cycle. And yes, there have been patterns of injuries found around the cyclical nature of the menstrual cycle. Here's the thing, that's not going anywhere. We're not gonna get rid of it. We can't. So, I personally and I've been trying to find research on this and I haven't found it. Can we stop looking at the menstrual cycle and actually look at the ramifications of training age of athletes and when they actually get access to appropriate strength training and management of nutrition? Because when we're looking at athlete access to strength training, male athletes typically start strength training prepubescent. So they are 10, 11 years old and they're in the weight room and they are working on bench, squat, deadlift. Or even younger, they may be working on non-weight bearing. They're working on those movement patterns.
Mhm.
When do little girls get access?
Yeah.
And when do little girls get access to true strength training and not just aesthetic training? And how often are women's bodies focused on the aesthetic appearance versus this true strength of what they need to do their sport? So when we're looking at the ramifications of what's going to make the biggest difference in a female athlete not having the same risk of ACL injury, most of the time they're not getting access to strength training until they are in college, post-pubescent, closed growth plates. That's a huge problem because now we have their entire tendon strength and structure, which we know tendons and ligaments behave better under heavy, heavy load. And if they're
Mhm.
not having that heavy, heavy strength training, which there's still this negative narrative within the culture of, oh, if you lift strength, if you lift heavy, you're gonna look like a man. Good, look like a man, but they're not. They don't have the testosterone to
Right.
develop that, but they're going to at least have the muscle structure to actually stabilize themselves. So the younger girls are allowed to actually get in the gym and lift heavy and have access points. Because, like, I know when I went to high school, girls weren't allowed in the school gym. That was the baseball team space. That was a
Mhm.
football team space. That was not the high school girl space. And so the only place I could go was, like, the community gym, which then they have the personal trainers there and like, "Let's make you look so skinny. Let's make you look so snatched." I'm sorry,
Mhm.
but that doesn't make me a good athlete.
Oh,
I'll
man.
get
No.
myself.
Oh, man. And that's the reason I didn't wanna have any set questions because I wanted just to let this go, okay? Oh, wow, I gotta dissect this a little bit. I
Sorry
will
for the
say
info
that but we
dumps.
are on the same page. Absolutely. I had been seeing a lot of our female soccer players and basketball players sustain ACL injuries, have a surgery, and then second ACL injury or third. I actually had started seeing concussion females having lower extremity injuries. So, yeah, I started doing the research on that. It was really interesting because and I can't remember the study, but it clearly stated that strength and conditioning coaches at the college level for female athletes were very frustrated. Coaches were frustrated because their female athletes coming in had not been exposed to the weight room, and so they were behind. The girls that came in that had been, they were so far, so much further along. And I can tell you here in Gaylord, that's still the case. I talk to my female patients all the time. Do you feel like you're getting adequate training? Well, no, the emphasis is still on football and basketball, a little bit on baseball. And but the oh boy. The other thing is I'm going to go back to the movement analysis. When the females here are introduced to weightlifting at the high school level, the movement, maxes over movement. The emphasis is on maxes. There is no movement analysis to see if they can even handle their body weight, to see if they can even handle just resistance bands, and it goes right on in. And I mean, I could tell story after story. I've got a girl that works for me right now. She's out of high school a couple years now, and she doesn't mind. There's no HIPAA violation here because we tell the story all the time. She was doing maxes in her personal training class at the high school, and the weight was way too high for squats. It took her all the way back, pulled her back, and she hit her head, base of her neck, on the barbell and suffered a concussion. And so this is the kind of stuff that drives me nuts. It shouldn't be happening. You brought up SFMA and everything. I do have a movement analysis called Kinetisense, and they now have integrated with Gray Cook and those guys so that things are digitized, so you can see. And I've used Kinetisense, man, probably for about 4 or 5 years. I love it, absolutely love it. And that's not a shameless plug. I also use a thing called Neck Care. So we got our range of motion, but more importantly, we got our sensory motor control. How well are you able to react and control and everything? That's why movement is so exciting for me right now, and then we can figure out the deficits and go and because the ultimate goal, right, Dr. McDonald, is to make them the best version of themselves, have them be able to achieve their personal best, whatever that's going to be.
Yes, and I agree that right now, just focusing on maxing and weights, like, I'm a huge you need to lift heavy. Lifting
Mhm.
heavy is what makes things stronger, but
Yep.
you have to do it in a way that isn't also going to injure you at the same time.
Yeah.
Now, when we're looking at, like, what's ideal perfect movement patterns, that's gonna vary person to person.
Mhm.
Everybody has different femur lengths, different femur shapes, different ways that their body has grown and developed.
Mhm.
So, one movement pattern for one person is not going to be the ideal pattern for another person, but there are some general things that need to happen in a certain way. Now, I'm a little spoiled, so I do all the sports chiro emergency, medicine. My husband is a strength and conditioning coach
Mhm.
and a master of exercise science. So when I tell you our dinner conversations are probably some of the weirdest things. If you see us at a restaurant, the conversations we have, but when we're looking at, and we've agreed, 1 rep maxes are probably some of the dumbest things athletes can do when it comes to that's just trying to be the bro in the gym. What we're looking at is we're really needing to develop those strength ranges into 3 to 5 rep maxes. Because when we're looking at what literature has shown, being able to do a perfect squat once means nothing for injury protection. Being able to do a perfect squat or a crappy squat the exact same way 100 times is more. Look at NBA, NHL, PWHL, Olympic athletes, and sometimes look at their like base movement patterns. They're frankly kind of trashy. Like they don't move how you would expect
Mhm.
a high level athlete to move, but in their sport, they're diabolical. Off sport, they like, have you ever seen I think we can all agree Connor McDavid, Sidney Crosby, Nathan McKenna, phenomenal hockey players.
Mhm.
Have y'all ever seen them try to
Right.
move without skates on their feet? Like, you take the skates
Right,
off and
yeah.
you watch them, like, kind of run or do stuff in the gym, and you're like, "Excuse me?"
Mhm.
Because they have geared their entire body to doing this one thing at a high level, and that's where trying to get everybody onto the same perfect movement pattern doesn't make sense because sports are so unique. And that's one of the biggest issues with training is they try to build so at least some high schools, so like one of the high schools I work with, it's a tiny school here, but every athlete in that school is required to participate in their strength program, male or female, every single one. They all learn how to both do basic bench, squat, deadlift. They also learn how to clean and snatch so
Mhm.
that they can actually really develop force and power through greater ranges of movement. So they have those skill sets, which ultimately means for my kids, I very rarely see, at least with that high school, I can't remember the last time I had a non-contact ACL across any of the sports. Contact ACL injuries, yes, we've had those where you get rolled up on, there's
Mhm.
nothing you could do when you have a 150-pound other person rolling into your knee, it's gonna go. But from a non-contact standpoint, I for that team, cannot think of an injury off the top of my head because they don't treat their female athletes different from their male
I
athletes.
love it.
And it makes my job 1,000 times easier. But they take the time when these kids are 7th and 8th graders and they have them in non-weight bearing movement patterns. How do you squat? How do you deadlift? How do you do these movements without weight so that your body is used to them and then they scale them up appropriately? And that's where it makes our jobs easier. So from a physical standpoint, what can we do? So I have used Kinetisense
Mhm.
and I like it, but I like Vold better.
Okay, that you are now I just spoke with Doctor Nick at Rehab Lab of Wisconsin. He was a
Oh, Nick
2021.
Agin.
Yes,
He was my student.
yesterday.
He was my student.
Doesn't surprise me. Okay, we got along I just talked to him yesterday because I'm looking at his social media and seeing what he's doing, and I had to call him. I said, "I think you guys got it going on with the future of chiropractic. You don't have this huge clinic. They practice out of one room. Outside of it, there's a gym." And he
Mhm.
just brought up that movement assessment system. Yep.
You do their set of here's the assessments they do on D1 athletes. Here's how you rank against them. Here's where you're showing inefficiencies compared to a D1 athlete. Here's your exercises you do to
Oh,
correct
geez.
it.
Mind blown. Okay, I don't that's but
I am a huge so this is a new system that Northwestern just got in February. Like,
okay.
we got it, like, the week before homecoming, so we really didn't fully even have it functioning. The Vald guy was here during homecoming and was teaching us how to use our system simultaneously, and then we've just been using it the last couple months to develop it, but this is the next thing. So, yeah, Nick and I have been chatting online and social media, and then, one of his associates Mike Giamarco is also, was a student the same time. I was a student, so we were he was a class behind me, so we were buddies,
Yeah.
and, like, we've just been talking about, like,
We need to upgrade our sports physicals now. This is woo, pretty
because I mean,
technology is advancing, and this is where chiropractors have got to embrace this, have to embrace because this isn't just sports physicals we're talking about. I see geriatric, they wanna move better, right? They don't want their number one fear is falls and fracturing and losing freedom, and this is a way I mean, quality of life, performance, what
autonomy. Everybody
autonomy.
no one wants to lose their bodily autonomy to age and dysfunction.
Exactly. Oh, I love it. Absolutely love it. Yeah.
But
I don't even
I
know what
it
keep going. I don't have
so sh
anything I'm speechless right now, which does
so
not happen
so
typically.
it just it goes into what is good movement, and so we're trying to curate those data points of what is good movement for the person that's coming in.
Mhm.
So that is something that the residents and our new director, Dr. Jen Waters, are working on is developing protocols for, okay, we have an athlete coming in and they participate in the sports. Now, we work with some unique athletes. So of course, everybody's aware of the big five:
Mhm.
basketball, hockey, football, soccer, baseball, soft. Everybody knows your standard high school sports. Now, Minnesota has other sports that, like a dynamo, the largest and insane high school. Like we have
Yep.
gymnastics, we have
Yep.
diving, we have swimming, lacrosse, tennis, golf. But then in the HPC, we also work with USA Tug of War. We work with Australian rules football. We work with ultimate frisbee. We work with flag football. We work with just some sport arts that have some different move patterns that need different things to manage and address that other sports don't need. And the more research comes out is off-season training, it's okay to be general. It's okay to work on building just general strength. So a lot of
Mhm.
times we use a system out here developed by the strength coach at the University of Minnesota, Cal Dietz, triphasic training where we're looking at hypertrophy, strength, plyometrics, kind of working in those three phases. And that's kind of our off-season training. The key is that you then still need to make it sport specific. So sometimes that's where college athletes in the summertime, when they're in their standard home gym away from their university, they are doing weird things. They are doing very weird things with bands. They are not doing necessarily super, super heavy things every day. They are looking at more ballistic movements. They are looking for adaptable movements. And that's something that rehab often misses because insurance won't cover it.
Mhm.
Insurance is concerned with getting you back to your activities of daily living. They don't care one of the activities of daily living for your mental health is the sport, that recreational sport you're doing. Or they don't care that, okay, you can get dressed, you can get in your car, you can drive to work, but you still have this 40-pound toddler you have to wrestle. And they don't really take that into account when they're assessing the need for your appointments that you're going to be doing. So when we're looking at rehab, there is a general process to think about when I'm looking at a patient and how I'm going to start with their care. And I use the 4 phases. Now the 4 phases structures it, but then I smudge all the lines between them because there isn't a way to do it clearly. So phase
Mhm.
1 of rehab, that's all about restoration of normal movement patterns. This is also where we're looking at trying to get better balanced muscle engagement. So like when we're looking at a knee injury, the quad likes to just stop working. The
Mhm.
quad likes to just take a vacation and we need to get that reactivated. But we also need to get them back to full flexion and full extension. So phase 1 is all about managing that while decreasing their pain and swelling. Then phase 2 is about getting them back to normal movement patterns, being able to do a loaded squat, being able to walk normally. And that's where insurance cuts you off. Insurance cuts you off after phase 2. Guess what? We have addressed the bare minimum of that injury, but we haven't actually done anything to reduce that injury from happening again. And that's what phase 3 and 4 comes in. Phase 3 is going to be traditional strength training. rebalancing, making sure things are equal, making sure you have good balanced movement. Phase 4, that's adaptability. This is where we're going to get your body ready to handle when the unexpected happens, because that's usually where injuries happen, is when you have exceeded your body's ability to adapt to the
Mhm.
stresses it's under. Specifically thinking about one of my friends back in the day from high school was like, "Oh, I'm gonna go play D3 football, but they need me to gain 60 pounds over the summer
Hmm.
to be the right size for my position," which and they did a decent dirty bulk, and what I mean by that is they just consumed so many calories. Like, they would go to McDonald's and they would buy, like, 6 Big Macs and just shovel them in for the calorie space while doing copious amounts of weightlifting and strength training. So they weren't getting fat, they were packing on muscle. Here's the thing, our body can adapt, and this is shown across many, many, many moons of research, 10% change per week. This is why when you go out for your first run of the year in the summer after hiding away on your couch all winter in Michigan and Minnesota, you go out and you try to run where you left off in the fall and you get shin splints, you get plantar fasciitis, you get Achilles tendinopathy, patellar tendinopathy, hip flex, like everything kind of falls apart. And you're like, oh my God, why can't I do this? Because you went from 0 to 60 instead of increasing at a slow 10% pace.
Mhm.
And so when we have athletes that do this massive bulk, this kid got to the sporting field, first time playing on turf, spent 3 survived 3 practices. The first 2 practices wore sneakers on the turf. First day on the turf with cleats, did one cut move. He did not tear his ACL. He plucked that booger from the bone, and he actually fractured it off his femur because his ACL was strong, but the bone actually hadn't adapted to handle the amount of force that a 60-pound increase in weight shift and cut could handle, because he had increased his weight in a unilateral direction and hadn't been doing any bounding, jumping, or cutting movements during this bulking. So when he asked his body to do it, it said, I will try, and then immediately failed. And that's where we're not necessarily addressing the training that individual athletes are going through. So yes, from a sports physical side, we need to be addressing the real incompetent movement patterns, the real incompetent imbalances, but
Mhm.
then we also have to look at training initiation and make sure that they are actually initiating training in a way that keeps our athletes safe by not exceeding their body's adaptability. So it always kills me in the summertime when football hits the fields for 2 and 3 a day practices, and yet these kids maybe have not been doing anything. So some of them
Oh,
have been
boy.
training year round
Yeah.
and are fine, but then the kids that only do football every fall die, and then they are dealing with chronic stuff for the rest of the season because their body didn't adapt and their coaches didn't appropriately address it.
Oh, man, I could year after year, it was always the incoming freshman because there is such a huge leap from 8th grade football that has practice maybe 2 times a week, I don't know, maybe it's daily, but there was no conditioning, no football conditioning. They didn't do anything during the summer because they were too intimidated to come up to the high school weight room, and we started seeing our numbers dwindle because these kids came out, and I know you've seen it too, they hurt. The first 2 days of two-a-days, they hurt, and then it's just and I would always tell the coaches, I said, you gotta back off us this group," or, they were obese, let's just call it like it, and there's no way these kids should have been out there. I gotta say, I was very fortunate we did not have any cardiac events in the 22 years, but I was always prepared for it because I thought at any moment it could happen, and I would see these kids that were very obese coming out in August to start, and then they quit football because it's painful, and so we had numbers dwindle. On a What you're really talking about is I'm big into neurology, and you're talking about looking at the neurological lens of each of these
Mhm.
people, 'cause, and I've been talking about this on the podcast, the Defeating Pain podcast. We are a body of receptors. We have mechanoreceptors in our joints. We have muscle spindles, and all these things feed into a part of the brain. And when those receptors aren't working right, that's when you're going to have chronic pain. Or if you've had a surgery and you've gone through traditional PT and it hasn't worked, it's because they're looking at it from an orthopedic lens and not a neurological lens. And everything you just talked about, those 4 phases, is the key to restoring normal activities of daily living, movement in people's lives. And this is a huge opportunity for doctors of chiropractic. And because we definitely can do this rehab. And for the patients out there, so this podcast really is for the people that are in pain.
Yeah.
And they don't know anything else. So take and listen to this, please, because there is an alternative for you. Not all has been done until you have attempted a rehab chiropractic that's neurologically based, that just isn't going to come in and rack them and crack them. Or you're going to go into a PT and it's going to spend an hour and 15, hour and 30 minutes with outdated protocols. I'll hit chiropractic and I'll hit PT. I mean, I'm equal opportunity calling it out for what it is. We got shortcomings in our healthcare system. And that we're going to have to pick that up at another time, because that is a whole other topic that I can just tell just by the brief time we've been, you're passionate about that. And I'm passionate about it, because there are people that are suffering. These kids are suffering. And then I'm not even talking about the emotional stress of just being a kid these days and the injuries that cause, the stress, and who's taking that on? Who's
Yeah.
treating that?
When we look at how people identify themselves, this is where we have to kind of look at some of these injuries through a sports lens or a sports psychology lens. And even for normal, everyday people, when you have an injury, it takes part of your identity. So, like, when I have a baseball player, because it's baseball season right now,
Mhm.
and they injure themselves during the school day. So they don't get injured during baseball, but they get injured in a way, because I had a kid during one of the field days at their school that they were playing yoga ball soccer in the gym, and they broke their foot, requiring surgery. Senior, this was a senior,
Uh-huh.
2 games left in the regular season. Their team went to states that year, and he didn't get to play. He didn't get to play. So, like, now you have this mental and emotional load of you've let your team down. You also have the mental and emotional load of I've been an athlete. I'm not playing sports in college. What am I?
Yeah.
Who am I? And I mean, this is something that everybody, no matter the level of athlete, rec league comes for everyone. You can't stay at the same high level. Rec league comes for everyone, whether it's the high school, middle school kid that never goes to varsity, whether it be
Yeah.
the NHL athlete, it's coming for you at some point, sometime, and you don't know when. And we need to better address sense of self, irregardless of what's going on. And when you have that additional load of loss of identity, when we're looking at the biopsychosocial model of pain, and we look at how our body interprets pain, it can be a huge pain driver, is this psychological and sociological cause. So, like, biologically, you break your leg, that's gonna hurt because there's a biological damage. But when we look at the psychological and sociological causes of pain that people like, "Oh, are you telling me I'm just making the pain up in my head?" Yes. Yes, I am. But guess what? All pain is receptors in your brain. It is all made up in your head, no matter the form and cause. But when we're looking at, like, no one will doubt, if you're asked to go do a presentation in front of 500 people, you're gonna get some rumblies in your tummy. You might get a headache, you might get nauseous. No one questions that. But yet that's still your body interpreting a non-noxious substance, a non-noxious situation as a stressor, and is producing symptoms in your body. So imagine what your body's doing as you've lost a sense of identity and how that's going to interpret and come out of yourself when you can't do the things that have defined you. You're going to have increased pain. You're going to have fatigue, lack of interest, depression, and anxiety that are going to come up as you're trying to heal through this process. And if you don't address those or have a provider that points those out to you, you can often feel like a greater failure, yet you've done nothing wrong.
Absolutely. All right, here's what we're just about at the hour mark, and I definitely wanna do this again, and because what you just brought up a huge, huge topic, and the next time we get together, I've got a case study that fits right into that, and so I wanna bring that up on our next time. If you'll have a case study, because we just talked about a global, but I wanna whittle this down because there's parents out there that are worried about their kids. There I mean, the whole thing. The kids that are depressed, they're anxious.
Do you want to know what I want to talk about?
Yeah.
When we meet again, I want to talk about concussions.
All
I would
right.
love us I would love to do a deep dive into concussions and head injuries and the misinformation that has been put out there because of literature. Yes, the literature showed the CTE causes, but then didn't really best define what that actually means for the general population. And then also like what we're because, like, the number of times I'll pull a kid for concussion, and then I have a parent screaming at me that I'm
Hmm.
taking away opportunities from we just had a kid that we pulled because they were confused, they were slurring speech, they were unstable, and the parent's like, "You're sabotaging my child's" this was a JV softball player. "You're sabotaging my child's opportunities." Dude, we're
Because
keeping your child alive.
everybody's going Division One, everybody's gonna be in the Olympics, everybody you're on. Next topic, concussions. Near and dear to my heart, absolutely. Okay, we will make that happen very, very quickly. So, everybody listening, thank you, Dr. McDonald. This has been mind-blowing, and next time up, we're talking concussions, and we'll do that very, very soon. Thank you, everybody, and we'll be back very quickly with a concussion story.